Hi folks, John Adamson, the Rehab and Documentation Guru. Today's Monday, February 3rd. So this is tip number 2 on improving the patient experience. And it's pretty simple, and some of you probably already do it. So when you're about to do something to a patient, you tell them, this is what I'm going to be doing with you or to you. And then you do that actual activity as described. And then after you get done, you do a recap of what you just did and what it means, and have the patient ask any questions. So for example, I go into detail, like let's say I'm doing a standardized test. I will tell them, this is the test we're going to be doing. This is what I'm looking for, and this is what you can expect while doing the test. If it's a test that's going to be very challenging to them from a cardiopulmonary standpoint as well, I will tell them, you can terminate this test at any point you like. You just let me know if you're getting too short of breath or it's working you too hard. So then anyway, we do the test after I've adequately explained it. We then perform the test, and then when we get done, while they're recovering, I say, this is how you did. This is what this means. Do you have any questions? And it's interesting, a lot of patients, especially on the standardized tests, even though they're patients, and I've explained to them that I'm looking for things that I can work on, they get a mindset of competitiveness. So for example, on the 30-second chair rides, there's age normative, and I will tell them, this is how you did, this is how you compare to other people of your age. And I've had a lot of patients go, what? You mean I'm not at my normal? Let me try it again. I'm like, well, let me explain something. I'm trying to find deficits right now for us to work on. And therefore, your test score tells the insurance auditor that there's a value to therapy being involved right now. And usually they're like, oh, okay. Occasionally I've had patients say, well, I want to do it again. I want to try again. And they get competitive with themselves, which is not a bad thing. It's kind of a motivation. It gets buy-in from them about what you're doing. But again, just to recap, you explain before, you allow them to do what you want them to do, and then you explain after. And I think patients get a lot of satisfaction from that when I've worked with them. They like to be informed, because so many times in healthcare, patients have tests ordered. They have no idea what those tests are for, or they're subjected to an examination, and the examiner has not explained to them what the heck they're doing. And so they're kind of in the dark, like, what does all this mean? And so by improving your communication with them about what you're actually doing and what it means, that does improve the patient experience. Tip number 2. Hope you guys have a great day. Take care, and God bless.